This is Pratima from Planet Physiology. Today we shall learn about physiological anatomy of ear, that is, structure of ear necessary to understand physiology behind mechanism of hearing as well as various disorders of ear. In this video we shall study outer and middle ear, and in the next part we shall study inner ear. Let us study the structure with the help of schematic representation. Ear is divided into outer, middle and inner ear. Outer or external ear includes pinna, which is also called as auricle, and the auditory canal, which is shown in violet color in this picture. Auditory canal terminates into the tympanic membrane. Pinna collects sound waves from various directions and directs them to the auditory canal. Pinna also helps in knowing direction of the source of the sound. Auditory canal conducts sound waves from pinna to the tympanic membrane. A clear and obstruction-free auditory canal is prerequisite to hear properly. At the end of auditory canal is the tympanic membrane, and it helps in signal transmission from external to middle ear. Coming to the middle ear, it is a small air-filled cavity in petrous part of temporal bone. It is bounded by the tympanic membrane laterally and oval and round windows medially. It contains three small bones called as auditory ossicles and two skeletal muscles, namely tensor tympani and stapedius. Let us study the components of middle ear one by one. The diagram indicates middle ear with its ossicle. Green part is the part of inner ear and represents cochlea. This is tympanic membrane and these are the oval and round windows. Located between the tympanic membrane laterally and oval and round windows medially is a small cavity of middle ear, shown in the pink color. Middle ear is connected to the external environment with the help of eustachian tube. It opens into the nasopharynx. So this is a eustachian tube. Now coming to the ear ossicles. These are three small bones in the middle ear. Because these bones are very small, they are called as ossicles. Shown in light blue color is malleus. It has head, neck, body and handle. Handle of malleus is also called as manubrium. It is attached to the tympanic membrane, whereas head of malleus connects to the next ear ossicle, that is incus. Incus acts as link between malleus and the next ear ossicle, that is stapes. In this diagram, incus is represented in pink color. Note its shape and the way it is attached to the stapes. Both these factors play very important role in transmission of sound waves. We shall learn this in detail during the functions of middle ear. The third ear ossicle is stapes, which is represented here in blue color. It is the smallest bone in the body and has shape of horseshoe. It has neck, handle and footplate. Footplate of stapes is in contact with oval window. Now let us study muscles of middle ear. The first muscle is tensor tympani. As you can note over here, this is the tensor tympani muscle. Its tendon is attached to the manubrium of malleus. Contraction of tensor tympani makes tympanic membrane tense and hence it is called as tensor tympani. Shown here, a small muscle is stapedius. It attaches to stapes. Contraction of stapedius muscle makes oval window stiff. Now let us quickly revise the important points in the structure of middle ear. Middle ear has three ossicles, namely malleus, incus and stapes, and they form the link between tympanic membrane and the oval window. The muscle tensor tympani is attached to the malleus and its contraction makes tympanic membrane tense. Stapedius is attached to stapes and its contraction makes oval window stiff. Eustachian tube connects middle ear cavity to to the atmospheric air. Now coming to the very important topic in physiology, functions of middle ear. The first and the most important function of middle ear is impedance matching. Impedance means resistance. Now, which resistance has to be matched and why is it necessary? Let us understand this concept with the help of diagram. External ear as well as middle ear are air-filled cavities, while cochlea in the inner ear is fluid-filled structure, and fluid always offer more resistance to the sound waves. As sound waves are transmitted from air-filled middle ear to fluid-filled cochlea, they need to exert more pressure on the oval window so that they can be transmitted with the same intensity to the cochlea and hence the auditory receptors. This process of matching the intensity of sound waves traveling in air and fluid compartments of the ear is known as impedance matching. It allows to overcome inertia of cochlear fluid and hence transmission of sound waves from air medium to cochlear fluid without change in its intensity. Let us study its mechanism. As you can make out in this picture, area of tympanic membrane is 17 times greater than that of oval window. Hence, the sound waves are concentrated on the smaller area while entering the cochlea. As we have noted earlier, incus has specific shape and peculiar attachment to the stapes. Due to this, it acts as lever. When it transmits sound waves from malleus to stapes, incus amplifies their intensity by 1.3 times. Thus, footplate of stapes exerts 22 times more pressure on the oval window and overcomes the inertia of cochlear fluid. This 22 figure comes by multiplying 17 times area difference and 1.3 times the force difference. In conditions like otosclerosis, ear ossicles fail to move freely. As a result, impedance matching cannot take place and person experience hearing loss of about 20 to 30 decibels. Second important function of middle ear is its role in attenuation reflex, which is also known as tympanic reflex. Basically, it is a protective reflex which prevents transmission of loud, damaging sounds to the inner ear. Let us see how. In response to sudden loud sound, tensor tympani as well as stapedius muscle contract simultaneously. Contraction of tensor tympani pulls tympanic membrane medially and contraction of stapedius pulls oval window laterally. As a result, ossicular system becomes rigid and decreases transmission of sound waves to the cochlea. Thus, cochlea is protected from loud damaging sounds. Attenuation reflex also plays important role to remove background noise so that person can concentrate on the sound with frequency more than 1000 Hz. Usually this is the frequency for voice communication and hence person can concentrate on the conversation by ignoring the background sounds. Attenuation reflex is also operated when the person is talking and hence it reduces hearing sensitivity to the own sound. This reflex has limitations also. It cannot protect cochlea from very sudden loud sounds like gunshot sound because it has latent period of about 40 to 80 milliseconds. So, a sudden loud sound reaches and damages cochlea even before the reflex is initiated. Also, tympanic reflex cannot protect cochlea from continuous loud sounds, for example, like that of industrial sound, because muscles show adaptation to continuous stimuli. This also forms the basis for auditory threshold shift. The next function of middle ear is equalization of air pressure across the tympanic membrane. As we have seen earlier, eustachian tube connects middle ear to the nasopharynx and hence to the atmosphere. Eustachian tube usually opens during swallowing, yawning or chewing. This allows to match air pressure within the middle ear with that of atmosphere, and thus the pressure across the tympanic membrane is equalized. Because the other part of the tympanic membrane is facing the external ear, which is already in contact with the atmospheric pressure. If this tube fails to open, say as in case of common cold, pressure across the tympanic membrane differs and causes pain in the ear. Similarly, during rapid changes in altitude, like while traveling by air, there is sudden change in the altitude. As atmospheric pressure reduces suddenly, the pressure in the external ear is also reduced, but the middle ear still has normal atmospheric pressure, which is same as that of sea level. As a result, many people experience pain in the ear. This can be avoided by chewing the gum. Chewing process opens the Eustachian tube and balances the air pressure. Let us quickly summarize the functions of middle ear. Middle ear helps in faithful transmission of sound waves to the inner ear due to impedance matching phenomenon. It protects cochlea from loud damaging sounds due to initiation of tympanic reflex. It also decreases person's hearing sensitivity to their own voice. And the last function is equalization of air pressure across the tympanic membrane due to Eustachian tube. In the next part, we shall study physiological anatomy of inner ear, mainly the cochlea. So see you in the next session. Thank you. If you enjoy my presentations, press the like button and share it with your friends. For more such videos, subscribe my channel and click the bell icon. Thank you for watching and see you in the next video.